next place would be medications. I've already entered a few medications in here like aspirin and Zyrtec. But if you were taking a vitamin, you can put vitamin C, and it'll go ahead and pull up all these types of things. You could go ahead and find it, and if you know your dosage, you can go ahead and enter that by just clicking on here. It'll add that to your medication list, and you can go ahead and hit save and continue. Now for allergies, right here it says it's marked for no known allergies, but if there are allergies, you can unmark this. And let's say you had an allergy to sulfa medication, you can go ahead and type in sulfa in here. You can go ahead and click that. Most of the time, sulfa allergies will result in a rash. You can go ahead and say it's active or inactive, and I'll just put this in here, and then you can go ahead and click save, and it'll go ahead and get that information in it. Now, all the information that we're doing right now, that on this side, it's pending approval from the medical assistant, who will be the first one to bring you back when you see your doctor that you're appointed for. So, but if you're in their past medical history, going through here, any diagnosis that you have, you can go ahead and go click that, just so we're up to date. The more information that you get on this side, the better it is for the provider, as they can treat you better. So I'll just click a few things here, just to make sure, show you how it goes. And on this one, I had already entered excision of squamous cell carcinoma, which would be a type of skin cancer. And once you've done that, you can just click on the bottom here, and it's automatically going to take you to the next screen, which is the musculoskeletal history. On this one, I'd already entered carpal tunnel syndrome. If you have any other diagnoses, you can go ahead and enter those, and then scroll to the bottom and hit save and continue.